you hear the word cancer, and after that, you just kind of go into these little dark zones, and you start thinking, I started thinking of all sorts of things. Not necessarily, am I going to die, but more like, are you serious? I'm sorry.
Yeah, okay. The first introduction real short, and then just Deanna Savage, breast cancer, and then get into your journey at the VA hospital, or your breast cancer, however you want to
But
say.
then we're going to have more of a conversation. You'll be looking slightly off camera to me. But for now, we're looking straight at the camera.
Yeah.
Okay, I'll do my best.
Yeah,
Okay.
Okay.
Yeah.
Deanna Savage, United States Air Force, from 87 to 91. I sell for a wine and spirits distributor to the greater Milwaukee area. At the time I was in the Air Force, I worked as an aerospace ground equipment mechanic. And then for the remainder of the year, a liaison between the Chief Master Sergeant and the Squadron Commander. I did. My first mammogram was at 40. And the reason why is my birth mother passed away from breast cancer. It was found too late, and it had already moved into other parts of her body. So one of the New Year's resolutions of 2013 was to get my mammogram. So I went in, and they asked me right away to get a biopsy. I said, maybe one more mammogram, double check, and about 2 weeks later I got the biopsy. And it was pretty intensive in that area. I did both breasts at the same time. It was a machine where I was lying face down, and it would go in and get the sample real accurately. But then the second time there was an invasive tumor behind my left breast that they had to do manually, which was another sort of pain that I didn't experience the first time around. So after the confirmation a week later, it was DCIS as well as a stage 1 triple estrogen positive tumor.
When the biopsy came back showing cancer, I called her. We had a discussion about what that entailed. We discussed a lot about coping. I think it's been kind of difficult for her being a young woman and having a bilateral mastectomy. That's a huge paradigm shift, I think, for any woman, but particularly a young woman. Breasts, they define our femininity as women in a lot of ways, and it's a very difficult thing, I think, for women to even consider losing one breast, much less both.
After she told me that she had been diagnosed with breast cancer, I immediately said to her, okay, who's going with you to your appointments? And she said, well, I'm going to go by myself. And I said, absolutely not. That's not a good idea. You need to have someone there with you. You need to have another set of ears. You need to have someone who's going to hear these things. Having been a cancer survivor myself, I know that a lot of what you hear is not understood, A, because you're so emotional, and B, because there's just so much information.
The next step that was in plan was to have surgery right away to take out the tumor as well as both breasts. That was the plan until Dr. Cheng and Dr. Redlick communicated that it would be wiser to watch the tumor decrease in size by treating it with chemotherapy first. Dr. Cheng, he was very, very cut and dry. This is what's going to happen. This is how it goes. He wrote it down on paper for me. And I was like, okay. It's hard to read because he's a doctor. But he took the time to separate it out and show me what my plan was for the year. And I was just sitting there scared to death, like, cancer? What? You're my oncologist? What are we going to do?
What struck me is her tumor has what we call a HER2 receptor. And a HER2 receptor is a very unique receptor that it makes the cell grow fast. And because of this receptor, the presence of this receptor, I make a decision and also discuss with our surgeon, and we all came up with an agreement is, I told them that is I want to actually give her medication first. So basically I will use chemotherapy plus what we call a target therapy. And the reason I want to do that is because of the aggressiveness of the tumor. I want to shrink the tumor as much as possible before the surgery.
The treatment of patients with chemotherapy before surgery, called neoadjuvant chemotherapy, has been very successfully applied to patients with breast cancer, with certain types of tumors. And the ability to eradicate all the invasive component of the tumor is what we strive for and provides the hope of a better outcome eventually.
Well, coming into the oncology department on a Friday was not always my favorite thing to do, but it needed to be done. So chemo takes a lot out of a person. I'd have to learn to relax before I started getting my treatment, before I got my port accessed. Even walking into the VA going uphill is sometimes difficult when you're not feeling 100%, and my heart rate would get up there and blood pressure.
No, it's a titanium port that sits under the skin. I believe it's made out of titanium, and then it's got a rubber, think of it like a rubber cork in it, and it's a self-healing material, so when you push the needle in, when you pull it out, it just closes back up.
Fred had a specialty IV job. Fred never made it hurt. That's largely one of my reasons why I liked him so much.
Well, I don't want to say they're not as good as Fred. We have some really good people on the IV team.
I gave her chemo, the long treatment that she was receiving. I think I gave her every treatment. I can honestly say she made me she inspired me to be the best nurse I could for her, because she was so inspiring just as a person. Through this whole treatment, she was telling me she went to Summerfest and she went to the jazz, but she just kept going. And I unfortunately, sometimes you have a headache and you think, I'm not going out, or I'm just gonna sit. And this girl did it all, and it's truly amazing.
My sister Denise does hair, and she's done my hair many times over the years. As it was falling out from chemotherapy, I decided we should have a little fun with it. So she came over with her clippers, and she gave me a mohawk.
Here it is.
If it's even,
Even to start.
you want to have a nice even parting at all times.
Okay, I'll keep that in mind when it's gone.
But when it started to grow back in, we had thought about what to do, and I had all shades of colors of wigs that I really enjoyed wearing. Well, I didn't have any hair, I figure. But one of them was never quite this platinum blonde. My hair grew in very dark, much darker than I remember it to be. And I wasn't quite ready to be a brunette, so I thought we should do platinum blonde.
She's incredibly blessed. She has had so many people supporting her, from family members to, again, countless friends who drove her to appointments, who picked her up, who visited her during her numerous hospital stays, who brought her food. I couldn't even begin to count the number of people that were on her team to support her throughout this process.
Danielle Howard she's been in my chemotherapy room a couple of times, and in her story of how she's fighting it now for a second time and coming here and having every single hope again that it's going to be tackled and not to be a detriment to her life is inspiring.
And it's almost like she just saturated the room with her presence. I can't explain it. It's almost like the Lord sent her, like she was an angel or something. I'm not trying to be super sappy or anything, but that's what it did for me. I looked at her, she looked so bright, and she looked beautiful and brilliant. And she started sharing how, she had been through it, I believe, about a year. She had did, chemo. Her hair had grown back. She looked great. She was dressed great. And then it just immediately lifted me. Like, I just knew that I was going to be all right. I just knew that I was going to make it. The first time around, really psychologically, I never got over it. But, I did chemo from January to like early part of April or March. And I'm over chemo. I haven't thought anything else about chemo because I just felt that camaraderie with Deanna. I felt like she had made it. She was speaking positive, even though she had some bumps. It was okay. And so I knew I was going to be okay. It's like I went from fearful to fearless.
She's got a lot of spirit and a lot of belief in God and the people around her that really touches me. I feel blessed to know her.
Deanna tolerated the treatment very well. She had no problem. She had about 5.5 months of chemotherapy plus what we call anti-HER2 treatment. And she tolerated very well, no major side effect.
Yet there remains in the breast some non-invasive components of the tumor which are not eradicated by the chemotherapy, and that can eventually become an invasive component. So it is absolutely necessary to remove all the disease in the breast to provide the best scenario for long-term cure of any patient. In Deanna's case, she had a type of tumor that was sufficiently spread out and located in both breasts. And in order to remove all of the tumor, the breast tissue had to be removed on both sides.
Oh, the first time I met Deanna Savage, I'll never forget it. It was spring of 2014. And I just remember thinking to myself as I walked by her and we smiled at each other, thinking, wow, what an attractive, bright, cheery looking woman. She must work at the hospital or be a drug rep. But then fast go forward, 2 weeks later, I walked in the room and I was shocked to see that same woman sitting in our concurrent clinic with our general surgeon, Dr. Rudlick, and our plastic surgeon, Dr. Sanger, with the first consult regarding breast reconstruction after her planned bilateral mastectomy.
When I first went under for the reconstruction, it was the hardest surgery of all, I would say, because of the removal of the tissue, the insertion of drains, and expanders. So a foreign object didn't exactly feel comfortable for about 4 months, but the process of it became more comfortable as my body adjusted to it, and they were able to monitor me pretty closely. Each week I'd go in and they would decide whether or not it would be filled or increased in size, so that way my skin could stretch. Physical therapy, you mentioned. I remember wanting to get into it right away. I'm all ready to go with my drains in, and they were like, I'm sorry, you can't start yet. And any kind of stall for me to go forward was very aggravating. I really wanted to just get full use of my arm again. I wanted to get going on it. So they were very compassionate and very understanding that this is what I wanted to do, but in the meantime I need to relax and heal. Sonia had such a gentle and loving way about her that was a different kind of therapy, I think. And Abby, she was so excited for me every time I made progress.
So I had initially met Deanna when she had got put on my schedule for outpatient physical therapy, and the consult had asked for working on shoulder motion. And she came in and I saw that she had some drains still in from her surgery. And being a therapist that doesn't primarily work with people post-mastectomy, I had called Sonia up to see if she had any input on how to deal with the drains or how much motion that she could do.
My first impression was that she needed to work in range of motion, and of course Abby was the best person to do that with her. But at the same time, I thought it was very important that she learned, how much range of motion she could do at that time, and she had to have enough range of motion to be able to lift her arm. Which at that point, it was not the right time to do it, but it was the beginning on how to do it, so to prevent other complications.
And so I saw her probably about maybe 6 weeks or so, and prior to her going back to get the breast reconstruction.
I feel like each time I met a surgeon, I was informed of my options, which were basically on reconstruction. I had an idea of what I wanted to do from the beginning, truly. I knew I didn't want to go to another part of my body to transplant. I just didn't want to cause more pain, truthfully.
We were talking about, the process and how she was doing and how she was coping, and it led into her being able to get boobs out of this. I said, well, there's a silver lining. You know, I've always thought I would, you know, not that I need them, but I always thought that maybe, what would it be like if I was an actual average size? So I pulled out 500cc saline bags, 250cc saline bags, and we're holding them up there and joking around like, well, this is what it would be like. And so we had a good time. So we were walking around with my flush bags on our chest. What do you think? So I think she made a decision that they, I think, was helpful.
So for example, in Deanna's case, we often offer immediate reconstruction at the time of the mastectomy. But for some tumors, if they are going to require either radiation or chemotherapy, there could be wound healing problems that might compromise the final result, so you may want to delay it. So in her case, a decision was made in conjunction with the treating surgeons and the oncology service that she should have a delayed reconstruction. So of the options that were presented, which include choosing an implant or from her own tissue, she eventually chose to have an implant-based reconstruction. So following the completion of her therapy, we then set a date and went ahead and placed a tissue expander. This is a preliminary step that allows us to expand the skin that has been shrunken down from the defect and from the scarring related to the surgery and radiation, and gently expands the skin so that we can have a better envelope to place the final prosthesis in. Then at a later date, after a certain number of months when the tissue had stabilized and her breast skin had softened, we then replaced that with a permanent prosthesis.
They understand what I want, and I want a natural looking breast. I don't want it to look like I had surgery. And there's still going to be a little bit extra, I believe, fat transfer, and then the nipple reconstruction.
And so there may be some time in the future when we will be able to, in fact, save the breast and even not have to remove the original site of the tumor, but that day has not yet come. And there have to be many, many studies to demonstrate the safety of that approach. We're not quite there yet.
I don't think I could do what my sister has done. I really don't think that I'm strong enough to do what she has done, to live what she has lived through. And I consider myself a pretty strong person. As much as I feel like I don't know what I would do without boobs as a woman, I don't know that I could do it. I have such incredible admiration for her for going through this process.
I didn't know what to expect by coming here. It was one of my options to pursue for treatment, and one of my places that I've been coming here for years for healthcare, and knowing that this is available to each and every veteran, it's really honoring to be treated the way that I've been treated and to have such personal care. I wouldn't want to be anywhere else. Part of that's so wonderful to be here is every single person that I've been blessed to be in contact with wants to be here, is happy to be here, feels honored to be able to treat vets. Healthcare is a personal business, and I've been to many other hospitals, and here I actually feel like there's a person-to-person connection, which I can't say everywhere offers.
That's just part of the job. You get really close to these patients that you see and that you work with for so long, but you come to this ending, and it's a great ending, and it's the end of this part of her life, and it's a great satisfaction to take care of your breast care patients and our veterans. So.
And as I mentioned before, for the last 10 years, we've had an emphasis on providing this service to our veterans. So we offer all of the different types of surgery, whether it's the microsurgical transfer of tissue or pedicle transfer of tissue where it's still connected and rotated into place, implant-based reconstruction, fat grafting, reconstruction of the nipple areola. And I think our veterans have this all available to them. We work jointly with our colleagues at the Medical College of Wisconsin for some of the microvascular procedures, and at times do some of the surgery there and some of the surgery here. But in all, we offer everything that anyone else could offer, and we have access to very good facilities.
But I can say that Milwaukee VA is, I would say, is an exception, because most of us are from Medical College of Wisconsin. Because of a close collaboration with Medical College of Wisconsin, so we can provide a breast specialist in the VA hospital. So I think I would say our VA hospital actually provide a very good care to breast cancer patients.
We've increased our ability to care for women veterans. We've increased our ability to care for women with breast cancer, and we've entered into collaborative relationships with our partner hospitals. And so this has, all these changes have elevated the care of patients at our VA, and particularly the women veterans.
The VA has been very aggressive in their approach to women with breast cancer, in that the plastic surgeons meet with the patients at the first visit with the breast surgeon. So that discussion about reconstruction starts happening from day one. And I think that's different from a lot of institutions where the reconstruction may be an afterthought after the woman has undergone her mastectomy and undergone her chemotherapy and radiation treatments and has finished her treatment for the cancer. Then they start thinking about reconstruction. So I really do think that the VA is ahead of the game as far as considering breast reconstruction.
Definitely thought about reconstructions. You know, I love the VA. I love the health system with the VA, and the VA has been great to me.
We have to remember, you know, that this was a place only for men, and that now, you know, with many women in the military, that we have to catch up, you know, to the outside world. But I think that we had really done a tremendous effort.
We really have worked to improve the culture so that women are recognized as having served in the military, and they're not just seen as somebody who's accompanying a male veteran. So there's a much higher level of respect and dignity afforded women patients. We have really excellent equipment, medications. The facilities are really top-notch for providing care here.
And the care has just gotten better and better. We have a fabulous team, starting in women's health, to the general surgeons, to the plastic surgeons, mental health, physical therapy. It's a team effort.
And it's a true team approach that allows the patient to be comfortable and to proceed in what is not always an easy situation when you're facing cancer, and know that this part of it will be done right.
I feel like I've grown and I've experienced probably more than I want to, but it's been a journey that I feel like really has enriched my life overall. It's helped me see what's important, it's helped me learn who's important, and I wouldn't change it, oddly enough. I feel really, really fortunate to be here, not just to be here, be alive, but to be here at the VA and to be able to bring some awareness to these individuals who take the time and the effort to care. Deanna Savage, breast cancer survivor. Wonderful. Dr. Cheng, starting with him, he stayed on top of me, making sure, I'm sorry, that sounds strange, but he cut.
We got what you were saying. Go with clarification. I didn't picture anything other than, you know.
She had her sister who is a riot, come in all of the time. And I don't know if I should say this on camera, but I'm not going to forget. She dumped her purse everywhere. There was feminine items everywhere, and she said her husband called her spreader because she would spread her garbage everywhere.
I'm not gonna be able to see anything for like days, so I'm gonna have just flashes of light.
Yeah, everywhere. Yeah, just don't drive, okay?
Okay.
So how many times were you arrested last month?
Yeah.
And we are done, but you said, sorry, 40-pound weight. What do you mean by that?
So that's when they do the mammogram. It's the same size as a car battery, and it smashes the breast down to be able to get the image.
Really?
Yeah. So that's why women don't like having mammograms. It's not just an X-ray.
Oh, okay, I got you. I didn't know. I thought you meant something like the clamps that she had to wear.
Yeah,
or something.
no, they have to. Yeah, they put a 40-pound weight on the breast to flatten it.
Oh wow.
Yeah.
That must feel awesome. I like it. Anything else you want to touch on or add?
I don't think so.
Okay.
You think it's good?
Yeah,
sure.
I do. I do.
Okay, just take a couple little things, Scott, obviously.
You've been here a long time?
I've been here since 1989.
So, what, 26 years, something like that? Yeah, about right.
Yeah, about over 25 years.
That's the same year that the first Batman movie came out with Michael Keaton. I was 7 years old. Yeah, I know. I'm reminiscing.
And if you want a perfect haircut, you gotta do it yourself. Well, I use the Flowbee, so this is all me.
Flowbee.
It's awesome. Flowbee is great.
Yeah.
I'm a mess.
And like we talked about earlier about you guys maybe talking to each other, I think that's great. It might be, I don't want to use the word cute, it's not a manly word to use, but it might be kind of different.
Different
Yeah.
personal. I like feeling on Dr. Redlick.
I loved him from the first time I met him. Like, that didn't sound right either. Cut. No, I loved him. I thought he was. I really. That's okay. All right. Cut.
Yeah.
Do you want my maiden name?
That,
okay.
Your makeup.
My maiden name?
Oh, I said makeup name.
Savage is American. Okay.
My name is blah blah blah, and then
The lower one, right?
Yeah,
okay,
this
just
one,
checking.
Yeah, let's go with it.
All right. Very well. Deanna Savage.